Welcome to my screencast presentation, Pain Assessment in Varied Patient Populations. By the end of this presentation, you will be able to list patient conditions that may cause pain. Also, you will be able to identify the correct pain assessment tool for use on different patient populations. The patient populations most likely to experience pain, and I focused on the acute patient setting, would be an injury, an infection, an exacerbation of a chronic condition, or post-surgical pain. The first scale to use for pain assessment is also the most likely to be used in the hospital for alert and oriented verbal adults. It's called the Wong-Baker FACES scale. The scale goes from 0, no pain, to 10, the worst pain you can imagine. For those patients that find it difficult to put a number to their pain, this scale indicates some facial expressions, or at least simplified facial expressions, that may help a patient out if they're having trouble correctly identifying what level of pain they're at. For unresponsive adults, such as intubated patients or critical care patients who are comatose, the CPOT scale, or Critical Care Pain Observation Tool, this ranges from 0 to 8 and looks at 4 characteristics: facial expression, body movements, muscle tension, specifically against passive movements, and compliance with the ventilator or vocalization for extubated patients. When assessing adults with dementia, vocalizations may not be reliable. For that reason, we use the Pain Assessment in Advanced Dementia, or PAINAD scale, ranging from 0 to 10, looking at 5 characteristics. Any one characteristic may be present in these patients with dementia, but when taken as a group, we can assume a certain pain based on their score. When we're working with pediatric patients, we use the FLAC scale, or Face, Legs, Activity, Cry, and Consolability. Again, this goes from 0, no pain, to 10, assumed great amount of pain, and the characteristics taken individually may not mean much, but as a group, we can assume a certain level of pain. In review, the 4 reliable pain assessment scales are the Wong-Baker FACES scale for alert and oriented adults, CPOT for unresponsive adults, PAINAD for adults with dementia, and the FLAC scale for pediatric patients. The next step is interventions. What do you do with a patient knowing their pain level, or at least assumed pain level? This is dependent on population and pain score. So, as your extension for this presentation, you are to list 5 non-pharmacologic pain relief measures and identify 5 analgesics and the nursing implications for each. This completed assignment will be used as a pass to your next class. Thank you for attending my screencast presentation on pain assessment in varied patient populations.